welcome to Pediatrics and Neonatology. This video is about childhood and neonate X-rays. 6-year-old boy with right hip pain. AP radiograph of the pelvis shows widening of the right epiphyseal plate with sclerosis of the femoral neck. This is consistent with slipped capital femoral epiphysis. Now, frog-leg lateral view of the previous patient shows posteromedial displacement of the right femoral head relative to the femoral neck. This is also consistent with slipped capital femoral epiphysis. Now, lateral C-spine radiograph showing perched facet at the C2 to 3 level. In this child, cervical spine dislocation and C2 end plate fracture is present. There is associated pre-vertebral soft tissue swelling. 12-year-old involved in a motor vehicle accident. Chest X-ray and CT shows air space opacity due to pulmonary contusions. Mediastinum is also widened in this patient who have a mediastinal hematoma and aortic injury. Bilateral small pleural effusion and hemorrhage are better seen by CT scan. Now, this is subtle distal radial buccal fracture. This fracture typically occurs at the diametaphysis, where the cortical bone is the thinnest. Now, disruption of the trabecular pectron at the fracture site is also present in this X-ray. Now, this is multiple bilateral rib fractures from non-accidental trauma. This infant has subacute right lateral 6th and 7th, left lateral 6th through 9th, and left posterior 9th and 10th healing rib fractures with callus formation. Now, this is 18-month-old girl with reactive airway disease due to a bout of bronchiolitis. AP radiograph shows presence of bronchial wall thickening with prominent central lung markings. 6-year-old boy with acute exacerbation of the reactive airway disease. Chest X-ray show presence of left lower lobe collapse, likely due to mucoid secretion obstructing the left lower lobe bronchus. Premature neonate with several tubes and line in place. This slightly rotated radiograph shows presence of left tension pneumothorax compressing the left lung and displacing left hemidiaphragm downwards. Now, neonate with air leak complication, a right pneumothorax. Air can be seen outlining the right lung. The thymus is not lifted away from the mediastinum. Now, here is 12-year-old boy with sudden onset of neck and chest pain. Lateral neck X-ray show presence of gas tracking up from the chest into the retropharyngeal region due to pneumomediastinum. Now, this is chest X-ray of 3-week-old neonate immediately post-cardiac surgery. It shows presence of air surrounding the heart within the pericardium, that is pneumopericardium. Note the air does not go above the level of great vessel because pericardium does not extend above this point. Now, this is hypertrophic pyloric stenosis. 4-week-old boy with recurrent vomiting. Hyperperistalsis of the stomach was noted clinically. Supine abdominal X-ray show presence of dilated stomach with a waist. Now, no gas is seen in the intestine indicating presence of gastric outlet obstruction. Now, 2-week-old neonate with recurrent vomiting due to malrotation and mid-cut volvulus. Plain abdominal radiograph show air in the fundus of the stomach and proximal duodenum. This is consistent with a double bubble appearance. Now, 3-year-old boy with abdominal pain and lower GI bleeding. Plain abdominal X-ray show presence of soft tissue mass in the central abdomen. This is outlined on the left side by air within large bowel. This suggests intussusception. Now, this is 8-month-old child brought to the emergency department with vomiting, marked abdominal distension, and almost in cardiorespiratory collapse. Plain abdominal radiograph in supine position show presence of free intraperitoneal gas, and intussusception was found to be cause of perforation at the surgery. Now, 6-year-old boy who swallowed a key. Abdominal radiograph show presence of linear metallic foreign body in the left side of the abdomen. There was some concern that this was a sharp object. Now, 11-year-old girl with history of fever, abdominal pain, guarding and rebound tenderness. Abdominal radiographs show presence of an ovoid ficolith in the pelvis. Ileus is also seen. A ruptured appendix and pelvic abscess was found on surgery. Now, this is 2-year-old boy with history of left-sided loin pain. Abdominal radiographs show the presence of a left staghorn calculus. Now, next is neonate with antenatally diagnosed bilateral hydronephrosis. VCUG show a dilated posterior urethra with a trabeculated bladder and right grade 5 VUR. These findings are diagnostic of posterior urethral wells. Now, this is axial contrast enhanced T1 weighted magnetic resonance imaging in the 7-year-old boy. It shows a left temporal lobe abscess with surrounding edema. Now, coronal T2 weighted MR in an 8-month-old. It shows a bilateral asymmetric abnormal high signal in the frontotemporal cortices and subcortical white matter. This is consistent with herpes encephalitis. Now, chest radiograph of a child with recurrent respiratory papillomatosis. It shows a tracheostomy, multiple bilateral cavitating nodules, and irregularity of the trachea and bronchi. This is consistent with recurrent respiratory papillomatosis. Now, chest X-ray showing bilateral streaky peribronchial opacities radiating from the hyla along with the peribronchial wall thickening. There is right upper lobe collapse and flattening of the diaphragm due to hyperinflation. All this is consistent with bronchiolitis. Now, this is chest X-ray showing a lung abscess in the right lower lobe along with the air fluid level. A chest drain has been inserted for the associated empyema. Now, this is a case of reactive tuberculosis. Chest X-ray shows bilateral patchy consolidation along with the cavitating lesion in the right middle hemithorax. Now, abdominal radiograph in a child with right iliac fossa pain. It shows an appendicolith, paucity of the bowel case on the right side of the abdomen, and prominent loops of bowel on the left. All this is consistent with diagnosis of appendicitis. Now, wrist radiograph in a child with chronic juvenile idiopathic arthritis. There is loss of joint space, particularly at the carpal bones, erosion and probably bony ankylosis with associated periarticular osteopenia. Now, this is chest X-ray of a HIV positive 6-month-old child who have pneumocystis carinii pneumonia. This shows hyperinflation of the lungs and diffuse bilateral consolidation. Now, next is chest radiograph in a HIV positive child. It shows bilateral nodular infiltrate, and this is consistent with lymphocytic interstitial pneumonitis. Now, this is axial CT scan in a 9-year-old with congenital HIV. It shows microcephaly, bilateral putaminal calcification, a coarse chiral pattern in the frontal lobes, and periventricular white matter low density. Now, this is AP hand radiograph. It shows generalized coursing of the trabecular pattern, acroosteolysis and subperiosteal resorption, which is more pronounced along the radial aspect of the 2nd to 5th middle phalanges. All this is typical for hyperparathyroidism. Okay friends, thanks for watching. Please like, share, comment and subscribe to my channel.